Assalamu alaikum. Ninth class students, today our topic is chain of survival and various medical emergency situations. Dear students, firstly we will see what is medical emergency. A medical emergency is an acute injury or illness that poses an immediate risk to a person's life or long-term health, sometimes referred to as a situation risking life or limb. Dear students, medical emergency means medically necessary care which is immediately needed to preserve life, prevent serious impairments to bodily functions, organs, or parts, or prevent the physical or mental health of the patient in serious loss. So, this is known as the medical emergency. So next is the various medical emergencies. The most common medical emergencies are bleeding, choking, seizures, severe pain, and heart attack. So next is the chain of survival. So what is the chain of survival? The chain of survival refers to the series of actions that properly executed reduce the mortality associated with sudden cardiac arrest. Dear students, it means a heart attack patient has little chance of survival unless immediate medical assistance is provided. The patient should be offered assistance in a certain order. This is known as the chain of survival. And students, the concept of chain of survival has an important bearing when it comes to saving the life of a heart attack victim. And students, the committee members had identified different principles that should be adopted when assisting a cardiac arrest patient. And the chain of survival consists of four vital steps. Dear students, the four vital steps together form the chain of command. Okay, so let's take a look at the four crucial steps of the chain of survival. So first is the early access. First step is the early access. So or provide early assistance. Dear students, immediate assistance is the first step in the chain of survival. A heart attack patient should be offered medical immediate assistance. And dear students, the sooner the patient receives assistance, the more the chance of survival. Okay, so this is the early access. So next step is early CPR. Early CPR, not CPFR, so that is CPR. So perform CPR. The first thing students you should do when you see a person suffering from heart attack is to call the emergency number. Okay, so in case the patient is not breathing or no pulse is present, you should start administering CPR. So what is the full form of CPR? Full form of CPR is cardiopulmonary resuscitation. So you should start administering CPR when in case of when the patient is not breathing well or when there is no pulse. So you should start administering CPR. And students, this is the next important step in the chain of survival. You should continue to perform cardiopulmonary resuscitation CPR until the person again starts to breathe or the medical team arrives. Okay, so this is the CPR. So next step is the early defibrillation. This is the third step. So perform defibrillation. The third important step in the chain of survival is defibrillation. This refers to using an AED. It means automatic external defibrillator device. The device is used to deliver an electric shock to the heart. Using the AED device can help restore normal heart rhythm. So this is the third step of the chain of survival. So next step is early advanced cardiac life support or advanced medical assistance. So this is the last step in the chain of survival, is receiving assistance by trained EMS. EMS means emergency medical service personnel. Okay, so there is no substitution for advanced medical assistance. Okay, so and my dear students, the heart attack patient's condition needs to be stabilized through the administration of oxygen, medication, and other advanced protocols. Okay, so these are the chain of survival. So there are four steps in the chain of survival, that is early assess, early CPR, early defibrillation, and early advanced cardiac life support. So my dear students, the chain of survival refers to critical steps that can increase the odds of survival of a heart attack patient. And student, CPR is an important life-saving technique that can be used in different types of life-threatening emergencies. Okay, it's all about our today's topic. Thank you.